My name's Andy McNabb. I'm one of the consultants in the emergency department of Morriston Hospital. I'm also the lead clinician for emergency medicine for Swansea. One of the things that's very clear in my speciality is that there's been a lot of progress in emergency medicine throughout the world, throughout England, over the last 10 years, and to an extent Wales has lagged behind a little bit. Particular areas that are sort of very well known now to be drivers of quality are having an increased consultant presence, which means having units with more consultants. More of the senior trainees in the department, particularly to supervise the less experienced doctors at night. For example, in an A&E department you would have usually doctors in their second year post-qualification ranging through to more experienced doctors. And for consistency now and good outcomes, you need to have at least one doctor of sort of 5 years qualification or more in the department on the floor 24/7 to help with the management of the more severely ill and injured patients. There's a limited supply of doctors both at the middle grade in emergency medicine because of the very onerous nature of the job. It's recognised as being very high pressure. A lot of sort of pressure in terms of the volume of patients, how ill the patients are, and the rapidity with which you need to make decisions and change from looking after one patient to looking after another. And then at the more senior tier, again, consultant resources are relatively limited. There aren't that many emergency medicine consultants in the UK. And in England, it's now standard that units are trying to have at least 10 consultants and maybe more, and units that take a large amount of trauma, as Morriston does, are looking to have 16, 20 consultants, and we're currently a long way from that. Wales has had difficulty recruiting in emergency medicine, as has the rest of the UK, but we are a little bit worse because we're perceived as not having moved with the times and not being quite as cutting edge as some departments in the rest of the UK.
So what would you like to see happen?
I would like to see improvement in care pathways, more joined up working with our colleagues in primary care, because there's an awful lot of patients who come along to emergency departments who have conditions that potentially could have been looked after somewhere else. So we need patients to know more about how to access those services. What we want to do is do the best job possible for the really sick, the really badly injured, because if you concentrate your resources on that, you get much better outcomes in terms of survival and decreased disability.